Welcome to an essential discussion about a critical health connection. Today, we delve into the intricate relationship between diabetes and heart health. Specifically, we will explore how diabetes significantly impacts your risk of experiencing a heart attack. A crucial question often arises: how much does diabetes truly increase the likelihood of a heart attack? The answer is profound and demands our attention. Diabetes leads to a substantial and concerning elevation in this risk. Understanding this vital link is paramount for both prevention and effective management. For anyone living with diabetes, or those at risk, this knowledge empowers you to take proactive steps. It is about safeguarding your most vital organ. We promise to go beyond the basic facts in this comprehensive overview. We will explore the underlying mechanisms and uncover surprising insights. Our goal is to provide you with a deeper, more actionable understanding of this serious health challenge. Let's state it clearly and unequivocally: diabetes dramatically increases your risk of a heart attack. This is not merely a correlation but a direct causal relationship. The statistics underscore the severity of this connection. People diagnosed with diabetes are, on average, 2 to 4 times more likely to experience a heart attack. This elevated risk is a stark reality. It highlights the profound impact diabetes has on the cardiovascular system. This heightened vulnerability is a direct consequence of diabetes' systemic effects on the body. The disease initiates a series of changes that directly compromise heart health. These changes unfold over time, often silently. The primary mechanism at play involves persistently high blood sugar levels. This chronic hyperglycemia is the hallmark of diabetes. Over extended periods, these elevated glucose concentrations inflict damage upon blood vessels throughout the body. This damage is not superficial, it affects the delicate inner lining of arteries. This injury creates an environment conducive to the buildup of plaque. This process is known as atherosclerosis, a hardening and narrowing of the arteries. As plaque accumulates, it progressively narrows the arterial pathways. These fatty deposits, cholesterol, and other substances adhere to the damaged vessel walls. They gradually restrict the space available for blood flow. The result of these narrowed arteries is a significant restriction of blood flow to the heart. The heart muscle, like any other tissue, requires a constant supply of oxygen-rich blood to function properly. When this supply is compromised, problems arise. Ultimately, this progressive narrowing and hardening of the arteries is the primary pathway. It leads directly to a heart attack. A heart attack occurs when blood flow to a part of the heart is blocked, causing heart muscle damage. The complexity of diabetes and heart attack risk extends beyond simple blood sugar control. Diabetes often coexists with other significant risk factors. These additional conditions compound the danger. These coexisting factors further elevate an individual's heart attack risk. They create a multifaceted threat to cardiovascular health. Addressing diabetes alone may not be sufficient to mitigate the full spectrum of risks. Among the most common cofactors is high blood pressure, also known as hypertension. Diabetes and hypertension frequently occur together. This combination places immense strain on the cardiovascular system. Another prevalent cofactor is high cholesterol. Elevated levels of LDL, or bad cholesterol, contribute significantly to plaque formation. This accelerates the process of atherosclerosis already initiated by high blood sugar. Overweight and obesity are also frequently observed alongside diabetes. Excess body weight contributes to insulin resistance and inflammation. Both of these factors further exacerbate cardiovascular risk. These conditions do not act in isolation, they exert a powerful synergistic effect. Their combined presence amplifies the damage to blood vessels and the heart. The sum of their individual risks is far less than their collective impact. Together, these conditions create what can be described as a perfect storm for cardiovascular problems. The body's defenses are overwhelmed by multiple assaults. This significantly increases the likelihood of a heart attack or stroke. A unique and often overlooked angle is how diabetes affects the quality of arterial plaque. It's not just about the amount of plaque. The composition and stability of these deposits are critically important. Plaque found in people with diabetes is often inherently more unstable. Unlike stable plaque, which grows slowly and is less prone to rupture, diabetic plaque is more volatile. This instability poses a greater immediate danger. This unstable plaque is significantly more prone to sudden rupture. A rupture means the fibrous cap covering the plaque breaks open. This exposes the inner, fatty core of the plaque to the bloodstream. When plaque ruptures, it triggers a rapid clotting response. The body perceives the exposed plaque as an injury. This leads to the formation of a blood clot that can quickly block the artery, causing a sudden heart attack. The reason for this increased instability lies in how high blood sugar alters plaque composition. Glucose molecules can attach to proteins and fats within the plaque. This process, called glycation, makes the plaque more fragile. This altered plaque is therefore more likely to break free. Even a small piece of ruptured plaque, combined with a rapidly forming clot, can completely block a coronary artery. This sudden occlusion is the direct cause of most heart attacks. A crucial and alarming point about diabetes is its ability to make heart attacks silent. This phenomenon is particularly dangerous. It often leads to delayed diagnosis and treatment, with severe consequences. What does silent mean in this context? It means that the typical chest pain, known as angina, may be absent or significantly less pronounced. Many individuals with diabetes may not experience the classic crushing chest pain. The primary reason for this lack of typical symptoms is nerve damage or neuropathy. Diabetes can damage the nerves that transmit pain signals from the heart to the brain. This blunts the body's natural warning system. This diabetic neuropathy affects various parts of the body, including the autonomic nervous system. This system controls involuntary functions, including pain perception from internal organs like the heart. The signals simply don't get through effectively. The consequence of these silent heart attacks is profoundly serious. Without the characteristic pain, individuals may not recognize they are having a heart attack. This leads to significant delays in seeking medical attention. Delayed diagnosis means delayed treatment. Every minute counts during a heart attack. Prompt medical intervention, such as opening the blocked artery, is crucial to minimize heart muscle damage. When treatment is delayed, the outcomes are often much worse. More heart muscle dies, leading to greater long-term disability. It can also increase the risk of heart failure and other severe complications. Therefore, for individuals with diabetes, vigilance for atypical symptoms is paramount. These might include unexplained fatigue, shortness of breath, nausea, or discomfort in the arm, back, neck, or jaw. Any unusual symptom warrants immediate medical evaluation. The good news amidst these serious risks is that the risk is largely manageable. While diabetes increases vulnerability, proactive steps can significantly reduce the likelihood of a heart attack. Empowerment comes from action. The paramount action for anyone with diabetes is effective diabetes management. This is the cornerstone of heart attack prevention. Consistent and diligent control of blood sugar levels is non-negotiable. Effective management encompasses several critical components. A healthy, balanced diet is fundamental. This involves limiting processed foods, sugary drinks, and unhealthy fats, while prioritizing whole grains, lean proteins, and abundant fruits and vegetables. Regular physical exercise is another vital component. Even moderate activity, such as brisk walking, can significantly improve insulin sensitivity and cardiovascular health. Aim for at least 150 minutes of moderate intensity exercise per week. Medication, as prescribed by your healthcare provider, plays a crucial role for many. This may include insulin, oral medications to lower blood sugar, or other therapies. Adherence to your prescribed regimen is essential for maintaining control. Beyond daily management, essential steps include regular checkups with your healthcare team. These appointments allow for monitoring of your overall health. They also provide opportunities to adjust treatment plans as needed. Consistent monitoring of blood sugar levels is also critical. This provides real-time feedback on the effectiveness of your management plan. It allows for timely adjustments to diet, exercise, or medication. Furthermore, it is imperative to address other coexisting risk factors proactively. This includes managing high blood pressure through diet, exercise, and medication if necessary. Regular blood pressure checks are vital. Controlling cholesterol levels is equally important. This often involves dietary changes, increased physical activity, and potentially cholesterol-lowering medications like statins. Regular lipid panel tests are recommended. The key to protection against heart attack in the context of diabetes is early detection and proactive care. Do not wait for symptoms to appear. Work closely with your healthcare team to develop a comprehensive prevention strategy. This proactive approach involves regular screenings, adherence to treatment plans, and a commitment to a heart-healthy lifestyle. By taking these steps, individuals with diabetes can significantly reduce their cardiovascular risk. In summary, diabetes is far more than just a condition of high blood sugar. It is a significant and potent risk factor for heart attack. Its effects on blood vessels and plaque stability create a dangerous environment for your heart. However, this knowledge should not lead to despair, but to empowerment. Understanding the link between diabetes and heart disease allows you to take control. Proactive steps can profoundly influence your heart health trajectory. Your health is your most valuable asset. By managing your diabetes effectively, addressing coexisting risk factors, and maintaining open communication with your healthcare provider, you can protect your heart. Take charge of your well-being. If you found this information valuable and insightful, please consider liking this video. Subscribe to our channel for more educational content on health and wellness. Share this video with anyone who might benefit from understanding this critical connection.